Pharmacy products have taken over social media. Everywhere you will see the top 5 picks, top 5 face washes, moisturizers, pharmacy sunscreens, skin lightening creams. It's everywhere. I'm a dermatologist and I've been prescribing pharmacy based products since 2011. So it's been 13 years. So let me tell you my experience about pharmacy products and whether that is the better choice for you or not. So, what are pharmacy products? Pharmacy products are those products made by pharmaceutical companies. Pharmaceutical companies have a strict regulation that they need to follow, and their products undergo quality checks from time to time. These products are then sold at a pharmacy or a chemist store with a prescription, and also they can be sold by doctors in their clinics and hospitals. So when I refer to pharmaceutical companies going rigorous testing, I'm referring to those which are reputed and which have been around for a long time. There are a lot of local pharmaceutical companies which do not attain that kind of standard and that kind of testing. But over and all, in general, when we talk about pharmaceutical products, we know that if 6% glycolic acid is written on the packaging, it does actually contain that, because they have to undergo a proper testing and certification for their products. So who are they made for, and why do they have a label written to be prescribed by a registered practitioner? So this label is written because these pharmaceutical products have to be used with prescription only. Here I'm not talking about face washes and moisturizers and sunscreens, but creams which are meant to correct any kind of concern. Those have to be prescribed by a qualified dermatologist. Only then you should be using these products on your face. So why should they be prescribed? What does it actually mean? It means that whenever you're given this product, you have been told how much quantity to use, how to use this product, how often to use it, for how long to use, what are the side effects that can happen because of this product, and also if in case you have any kind of adverse reactions, you have somebody to fall back on. Compare this to just buying a pharmacy product because some influencer recommended it, and imagine if something goes wrong, immediately you have nobody to fall back on. Okay, because these products have to be used in a proper quantity, in a proper way, and for a stipulated duration, it is very important to have a registered practitioner prescribe it, so that the chances of side effects go down. So what is the difference between a pharmacy product and a drugstore product? There are some amazing pharmacy products, but pharmacy products don't always mean better, especially when you are not using it with a prescription. Okay, so for an example, for you to understand it well, let's compare like a GPL 6% cream to a 6% cream that is available over the counter without prescription. Don't just go by concentration, it is also the vehicle that it's in dissolved in. Because it's a prescription medication, it'll be slightly stronger and will be more undiluted than a cream which contains 6%. By undiluted, I don't mean the percentage. I mean that it'll have a more, let's say something over the counter will have a more creamy vehicle, will contain some other soothing ingredients that make sure that it will not irritate the skin. Whereas GPL6, which is a prescription based cream, will be in a very pure form, because it has been just taken for granted that this will be used only after consulting a registered practitioner, and that the person who's using this knows how to use it, for how long to use it, and in what quantity to use. So what I'm trying to say is that pharmacy products do tend to be stronger, and you need to use it correctly in order to get full benefits. Because over the counter medications can be used without prescription, and they do try to take those extra steps to avoid any kind of side effects. So the creams are usually a little moisturizing, have anti-inflammatory ingredients in them, and feel more soothing on the skin. Whereas pharmacy based products, because they trust that the person who is writing it knows how to use it and how to prescribe it, that's why they are more concentrated and also don't have many soothing ingredients. So usually we use it with a moisturizer or as advised. So that is why I do not suggest you to just go ahead and buy any pharmacy products that you see on social media and just start applying on your skin, especially if it is something like glycolic acid, or adapalene, or tretinoin. These require prescription, these require to be used in a correct way, and you can't just blindly follow any influencer online and start using it on your skin. Do pharmaceutical companies only make prescription based products? No. Pharmaceutical companies also make over the counter products which do not require prescription. These are usually face washes, moisturizers, and sunscreens. This can be used if you are somebody who likes using a particular moisturizer, which is a pharmaceutical based moisturizer. You can go ahead and repurchase it without a prescription, because these ingredients and these products do not actually harm the skin even if used for a long time. But prescription based medications which comes with a labeling, that should not be used without prescription. So any product meant for treating an underlying condition, let's say you have dark spots, you have acne, you have melasma, you have post-inflammatory hyperpigmentation, or you have hair fall, or you have any kind of skin ailments, to reduce that or to improve that concern, those require proper prescription based creams. Okay, so these creams should only be used with a dermatologist prescription. So abroad versus India, what is the difference? So whenever I'm giving information about any kind of product, I'm always scared, okay, whether it will be misused, and whether somebody will actually just go to a chemist store and just start using it without actually understanding how to use it correctly. So I'm always scared whenever I'm giving information, that am I giving out too much information? Should I just not name any brands, which I don't. Pharmaceutical products I stay away from. But sometimes there is a condition where I want to give you information that yes, in this condition there is something that can work, and you should go and take this treatment. But what happens in India is that you can just go to a pharmacy and buy this product without any prescription and start using it without correctly understanding it, and then you can land up with a side effect, and that makes you lose trust in the doctor who's talking about it. So that's why it's always a very scary kind of a path whenever I try to give information. Because see, abroad what happens, they are very very strict. In US, in UK, they are very strict with prescriptions. You cannot get creams without a doctor's prescription. It is all very tightly regulated. But here we sometimes joke that even chemotherapy drugs can be home delivered. So here, because the regulations are so lax, it becomes very very difficult to kind of keep track, and also to keep track of how much information is too much. So that's why I try to not give out too much information which can be misused. Even though I love educating and I want you to be empowered, but there's always a fear that I feel that if I talk about an ingredient, it might work great, but not great if you use it without a prescription or without supervision. Okay, so that is the difference between abroad and talking about drugs in India. So how can we make it better? We need more regulations in order to make sure that these prescription based creams are not misused and are not dispensed without prescription. Because see, there are certain conditions such as psoriasis, eczema, vitiligo, atopic dermatitis that I'm asked about often, and these require prescription based creams. But I'm always scared to make videos on these topics, because I feel that even if I name the chemical ingredient in this, you can just go to a pharmacy and purchase it without any prescription. And this actually requires the creams to be used correctly for a short period of time, to overcome the acute phase, and then maintenance is done with other creams. So it requires a personalized counseling and a proper professional supervision. So that is why we as doctors wish that there were strict regulations regarding dispensing of medications, so that we could give more information and the patient would be able to manage their condition better without us being fearful of the products being misused. Now we come to the $1,000,000 question: is pharmacy always better? So, as somebody who's been prescribing pharmacy products for all this while, so there are two categories that I look at. If you are somebody who has a skin concern and a problem that needs to be solved, then yes, pharmacy is definitely better, because the ingredients, the combination of ingredients, the way it works on the skin is more predictable, and we trust it more. And because it undergoes regulations, we know that this is going to show the impact that it says. So definitely in those conditions, pharmacy is better. In other condition wherein it's just for cosmetic use, or you feel just want to maintain your skin and look and feel better, then even over the counter medications or cosmetic products are also equally good. Just need to know how to choose it. Okay, so here I'm talking about any of these pharmaceutical products which make over the counter medications. You can use that. Let's say some moisturizer, face washes, sunscreens, those can be used for sure, especially if you are somebody who feels that your skin darkens after using a sunscreen, or you want a fragrance free sunscreen, or you have tried many sunscreens in the past but has not suited you. Then using a pharmaceutical sunscreen can definitely help, because of the labeling that is done properly, and also because it actually does what it says. So then those can be used, not a problem. But if you are somebody without any kind of skin concern and you just want to maintain your skin, then using pharmacy based creams are not advisable without a prescription or a supervision, because this can sometimes cause irritation to the skin, cause dryness, flaking, and then you have nobody to fall back on, and you tend to feel that it made your skin worse. So overall, if you just want to maintain skin health, then do you need pharmacy products? No, you can just use any kind of over the counter products or even cosmeceuticals. They also have good moisturizers, face washes, and sunscreens. If you want, you can use pharmaceutical too, but it's not necessary. So should you always be using pharmacy based products? No, you don't need to, especially if you don't have any skin concerns. And please don't use any kind of pharmacy product where it's labeled to be prescribed by a registered medical practitioner. Such creams should only be used with prescription and never without it. And also remember that, whenever there is a pharmacy product, let's say like a shampoo or a conditioner, I have personally found that the cosmetic shampoos and conditioners tend to be more impressive. Patients like the feel of their hair much more after using the cosmetic products, because they are made to please the consumer, whereas pharmaceutical products mostly are meant to treat the condition, not necessarily to please you. So even when you go for any kind of moisturizers and sunscreen, you might not feel that it feels really nice on the skin, or feels very luxurious on the skin. No, so that's not why pharmaceutical products are made. They are not meant to feel luxurious, they're not meant to feel very good on the skin. It's just meant to do its job. Okay, so especially when it comes to hair care products, of course there are a lot of hair serums meant for hair fall, which I really swear by. Those really work well, where I trust pharmacy products. But when it comes to shampoos and conditioners, I feel that non-pharmacy shampoos, conditioners have an edge. I feel they are more conditioning, they add more shine to the hair, and also are more pleasing to the consumer than the regular pharmaceutical products. So remember that everything pharmaceutical is not required in your routine, and always make sure to titrate and create a routine, whether it's skincare routine or hair care routine, according to your requirements, according to how your skin type is and hair type is. And don't go by what the social media says, and don't go by what the influencers are pushing, especially regarding prescription based cream. It really hurts my heart when I see influencers promoting creams which are strictly prescription based, such as tretinoin, glycolic acid, and adapalene. If not used correctly, it can really cause irritation to your skin, and sometimes can even leave behind dark spots that can last for a long time. So please don't fall for this, and you can take a proper consultation and use the creams correctly. Otherwise, there are really good cosmeceutical counterparts that are safer and can be used without prescription as well. This was a slightly offbeat topic, but because I keep getting asked about this, I thought I would address it. I hope you found this video useful. If you like such skin and hair related content, you can follow me on my Instagram handle, Dr. Achal MD, where I post such skin and hair related content daily. Thank you for watching.